To send a pathology request, you will need to open a patient record. Go to the clinical tree and scroll down to Pathology Requests. Right-click and select New Electronic Pathology Radiology Request, or go to one of the two icons above the screen. By clicking on these, a new box will open where you can select the hospital you wish to refer to. Click OK, which will open a new box informing you are about to launch the pathology requesting website. The website will open. Within the Pathology suite, you are able to view previous results by selecting Services and Patient Report List. Here you can see all reports and also download to view each individual report by selecting the patient and clicking Download. The result will open. To return to the previous screen, select Back. To view tests requested, select Services and Patient Request List. To order a test, select Services and Order Test. Choose the test you wish to order and click on Continue with Request. Type a reason for the request and complete the order details. Also, add your name and contact details here, in case there is need to contact you urgently about the results. You can forward a copy of the results to another clinician, mark the priority of the result, and also mark Collect Today or unspecified date and time. The sample will need to be marked with date to be sent, so colleagues send on the required day. Next, click Accept Request for the test to be processed. Here you can print the test request form to send with the sample. Click Proceed. There are also a few tools in the system you can use to help you when selecting the test you would like. You can select the test by looking up a test by A to Z, or by the initial diagnosis, where you will find a list of suggested tests. Click on the selected diagnosis and select either Complete All or Select Individually. There are also categories for microbiology and histology and cytology. You can also use the search button by typing in the test you require. Once the request is completed by Pathology, the result will arrive back in the Pathology inbox. The number of results you have waiting will be displayed by a number on the Pathology icon on the home screen. By clicking on the icon, the results are shown below. Click on the Pathology inbox to view results. Your results are displayed. However, it is possible to review results sent to colleagues by unclicking the Only Show reports assigned or directed to me. All results are displayed. Results in red are abnormal, blue normal, and black do not have a range attached to them. You can redirect a result to a colleague by clicking Redirect. Choose a staff member to assign to and click OK. The result will be sent to their inbox. Information flags are displayed to the right of the screen. If you hover over these, information will be displayed. Information such as whether a result is matched to a patient or matched to a staff member. To review a result that has come down from pathology, double-click on the result you wish to view. Double-clicking will open the patient record. This is shown by the demographics box in the right-hand top corner. When looking at the result, you can see the battery headings along the top. Each battery heading contains results. Click on the heading to open up the result. At the bottom of the screen there are indicators highlighting ranges for results and previous result findings. Clicking through the headings, you can read and review the results. Before you can file a result, each heading needs to be clicked into and reviewed. Then you need to make the choice on whether to file one battery report or the entire battery report. Click on the icon to file the report. A box will appear. Choose a result indicator and a follow-up outcome. Below you can mark comments, and there is a button below to archive the result into the patient record. This will mean it is filed away and no longer on the home screen of the record. It can be found in the tabbed journal. Once you have clicked OK, the screen will move on to the next result. The process of opening the next result is very quick, and therefore you can miss that it has moved on to a new patient or stayed with the same patient but a new result. So please be cautious. Before any pathology results are dealt with, they sit in the patient home screen. There are two sections: Pathology and Radiology to file and Pathology and Radiology to archive. Once pathology results have been actioned from the pathology screen, they will disappear from the section Pathology Radiology to file in the patient record. However, they will stay in the archive section until archived. Archiving should take place when the clinician is happy all actions have been followed. Archiving can be done from the patient record by clicking on Inform or Archive Pathology and Radiology, or it can also be done when filing the battery in the Pathology View screen. This section can also be used to record that you have informed a patient of their test results. This can be done by clicking Inform All. When clicking Inform All, we are assuming you have informed the patient either verbally or in writing. Test results can be viewed in patient records by scrolling down the clinical tree and clicking on the tab required, i.e. Haematology. The results are displayed in a chart with the dates running along the top and the field with the test result name in running down. the centre of the screen. These results will also be from any other unit with a shared record, i.e. GP unit. This helps you to have a clearer understanding of the patient.